My name is Connie Harrington. I live in Arizona. I am a 3+ year cancer survivor, and then I'm also personally doing a lot of writing, and I have been blessed to have an amazing husband. We have 6 children and 9 grandchildren who have been a really positive focus for me and are all loves of my life. I found out that I had pancreatic cancer on my birthday in December of 2021. And I started chemotherapy. And then I found out that I was not a candidate either for surgery or for regular radiation. And my radiotherapist said he knew who could help me.
Connie was diagnosed with a locally advanced pancreatic cancer, which means she did not have surgery as an option. She received chemotherapy at the Mayo Clinic, and she did well with that for quite a while. And she was considered for radiation therapy there at Mayo, but because of the extensive nature of her tumor, they felt that it was not safe to treat her with standard radiation. And that's when they called us here at the Miami Cancer Institute, because they knew of our ability to treat patients with advanced tumors successfully with an advanced type of radiation therapy called MRI-Guided radiation, using a device called the Meridian-Linac.
Everything was fantastic after treatment, and then I had a second episode where my cancer returned in February of 2024. When I first found out my cancer had returned, I was truly stunned. I really felt I was healed. The next emotion I felt was faith. God had taken care of me through that whole first treatment, and that He would definitely do it again.
The treatment that Connie got with the Meridian device is so unique. We treated her not just with a second round of radiation, but a very, very high dose of radiation that essentially was the same as the first time she was treated. And that essentially is almost never done. And this is an approach that we have been particularly interested in and having great outcomes in for patients who need additional radiation in the same location. And in fact have a clinical trial exploring high-dose repeat radiation or reirradiation for tumors in the pancreas and other abdominal sites, and are having good success with that.
When I first met Dr. Chuong and his team, I was so impressed by certain qualities that to me are key for a doctor to whom you are entrusting your life. I feel like they are my team and they're working for me. And that personalization, when you have cancer, it means the world.
And what we're seeing is that because of the ability to be so precise with the radiation treatment, with the high dose going into the tumor alone, and us being able to spare the tissues around the tumor, we can significantly increase the radiation dose that we prescribe and have a much better chance of eradicating tumors, even in the retreatment setting, which even a short few years ago was never thought to be possible.
It was incredible. I felt wonderful during the treatment. I had no pain, no discomfort. I had no abdominal distress, and it was absolutely an amazing result.
Connie's been in follow-up for about a year after I last treated her, and she's been doing amazingly well. To give some perspective, the expected 2-year survival rate for patients with her disease after diagnosis is only about 20 or 25%, and she is now well beyond that expectation. And I would say with conviction, the radiation therapy that she received here was a main reason for her to still be not just alive now, but alive with no evidence of any cancer. And her tumor markers remain completely normal. So we're absolutely thrilled for her because of that.
Never give up hope. It is the key to healing. And I have found that to be true.